The Supreme Court is hearing arguments on a historic case that could impact families with transgendered children across the country. Justices are deciding if a Tennessee ban on medical treatment for trans kids violates the Constitution. Perry Russum covering this developing story tonight.
Today, hundreds of demonstrators outside the Supreme Court as inside oral arguments are being heard on a case that could define gender-affirming care for transgender children across the country.
This case is about access to medications that have been safely prescribed for decades to treat many conditions, including gender dysphoria.
The case was brought by a family in Nashville, Tennessee, whose 16-year-old daughter came out as transgender when she was in the 7th grade. She goes by LW and asked us not to show her face.
It's not very comfortable being trapped in, because it just doesn't feel like you.
After months of doctor's visits and therapy sessions, LW and her parents decided to start using medication to delay puberty and later hormone therapy to combat gender dysphoria.
Without objection, the motion to reconsider goes to table.
Last year, lawmakers in Tennessee banned the treatments LW was receiving, in part citing uncertain long-term harm.
In Tennessee, we think this is a risky procedure.
26 states now ban gender-affirming treatments for children, even as major American medical associations have endorsed the treatments for more than a decade.
Just as using morphine to manage pain differs from using it to assist suicide, using hormones and puberty blockers to address a physical condition is far different from using it to address psychological distress associated with one's body.
Critics of the ban say they discriminate, as the same drugs are legal for kids who are not trans. LW's family argues Tennessee's ban violates the Constitution.
I want to listen to the doctors, and I want to listen to my kid, and I want to take care of him.
Chief Justice John Roberts questioned whether the High Court was best situated to address an evolving medical issue or if it's better to be handled by the states. A ruling could come in the next few months. Perry Russum, ABC News, the Supreme Court.